Here we go. Sorry, I just need to be able to reference something, and I want to make sure I'm referencing it correctly for you. All right, so when we talk about reagent strips, first off, remember we had those chem test reagent strips, and we dipped it twice in there, and we wiped it off. But you should have noticed that there were pads on there, so to speak, right? And those pads are used to determine what amount of a substance is in said urine. For example, one of the things that we saw on those pads was glucose, right? Okay, so it's used to detect how much glucose is in said substance. So when we talk about reagent strips and its connection with urinalysis, in order to do urinalysis, we need the reagent strip to figure out just how much of each substance, whether it's glucose or ketones or protein, blah, 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 whatever it is in said urine. So that is what reagent strips are for, particularly to detect the presence and amount of substance in urine. Okay? What do we do with the first drop of blood? Okay. All right, so then that's with what kind of? Capillary puncture, right? So capillary puncture, otherwise called dermal puncture, okay, because we're puncturing the dermis, the second layer of the skin. We always wipe away that first drop of blood. Somebody quickly just tell me why. Why would we want to do that?
Because it has oils in it.
Right. It's got all that trash in there that we don't want, right? So trash equals bad, okay? Talking about GTT. First off, what kind of test is
Glucose
a GTT?
content.
Okay. So yeah, what kind of test is that? Indeed, it is a time test. What is a GTT?
Glucose content.
Very good. GTT is a glucose tolerance test, and it is a time test. That's important. Okay, this is to say that if you don't do it at that particular time, then they will probably either have to do it again, or the results will be off, or the doctor would just be mad at you and you lose your job. We just don't want any of these things, okay? So, 2-hour postprandial. 2-hour postprandial, particularly we would do, well, let's rewind a little bit. What is a 2-hour postprandial?
2 hours after.
Right. Prandial or postprandial, meaning after the meal. 2-hour postprandial test would be a test that we do 2 hours after their meal. But why would we want to do a 2-hour postprandial test?
To test the metabolism, glucose metabolism.
Okay, get more general.
They got diabetes.
Diabetes, what kind of diabetes? Mellitus, okay? So diabetes mellitus, that's the metabolic disorder that I was talking about, in which to say, hey, we want to see how well you did at metabolizing all of the sugar that you just ate. Not only metabolizing it, but getting it from your blood into the cells. So basically a glucose test, GTT, glucose tolerance test, but a particular time. Okay? Talking about cholesterol. First off, which cholesterol is the good cholesterol?
HDL.
Okay, then which one is the bad one?
LDL.
Okay, very good. So LDLs, or low density lipoprotein versus high density lipoprotein, right? Low density lipoprotein versus high density lipoprotein. You need to know the high density lipoprotein is the good protein. Okay, or excuse me, the good cholesterol. But we also need to know when we're checking someone's cholesterol, it tells us about the function of something specific, or a particular set of organs, so to speak. Okay, the liver. Wait, not the pancreas. Wait a minute. The liver. No. Liver.
It removes excess cholesterol
And
cells in the liver and takes it to the liver to be excreted.
Well, it tells us, well, if there's a little tiny side note in that chapter. But anyway, it can tell us about how their liver is doing, mostly how their liver is doing, yes, but also how their thyroid is doing. And not only just how their thyroid is doing, but how their blood vessels are doing. if you got high cholesterol, or particularly high cholesterol, that bad cholesterol, which is the what cholesterol again? LDLs, very good. If you got high LDLs, then this means we know LDLs stick in your blood vessels. We know LDLs cause heart disease. We know heart disease causes CHF, which is congestive heart failure. We know that LDLs are basically bad for you. So when we check cholesterol, really we're checking not just the thyroid, not just the liver, but also how are our blood vessels doing. Does that make sense? Mm-hmm. Sweet. So let's push. This is in red because we touched it, but we didn't thoroughly go through it. So I really want to make sure that you know this. First off, I told you that you would get a Buffy coat if the tube you used had an anticoagulant in it. I did tell you that, but I did not tell you, okay, you should have read it, is what's in the LDLs. Excuse me, what's in the Buffy coat. Who knows, first off? Say again? WBC, which is a what? White blood cells, and what else? Platelets. Okay? White blood cells and platelets. White blood cells and platelets are in the Buffy coat. Okay? When we, before we get into this next thing, the H&H and so on and so forth, when we centrifuge blood, what goes to the bottom?
Form elements.
Well, particularly what?
Red blood cells.
Packed red blood cells. Packed red blood cells. And the reason why they say it's packed is, have you ever been, I don't know, somewhere at the club or something, and it was packed, right? Everybody was just all up on each other, right? Okay, not on purpose. They were just all up very close to each other. Okay, it was packed in there. And that's what I want you to think about kind of for the bottom portion of when we separate blood, is that at the bottom is the packed red blood cells. They real close up in there. But at the very top is the what?
The plasma.
Plasma. Very good. The plasma. All right.
I feel so smart.
Yeah. So, what is an H&H test? Hemoglobin and hematocrit test. Very good. So, in that sense, what is hemoglobin? What does the hemoglobin do?
It gives good color.
It gives the blood its color.
It carries oxygen.
Transports
Yeah.
carbon dioxide.
Very good, very good, very good. Huh? Oh yeah. Very good, very good, very good. This is to say that hemoglobin, okay, not only gives the color its blood, it's the reason why your blood is red, is because of the hemoglobin. But we really don't care about the color. We care about what the hemoglobin is doing. Okay, in the sense that it carries oxygen, and it also carries the carbon dioxide. Okay. Carries the oxygen in, carries the carbon dioxide out. Okay, and that's pretty important. But the hematocrit count tells us what? The hematocrit count is defined as what? Amount of red blood cells in a given sample. Okay, the amount or percentage actually of red blood cells in a given sample. Okay, science tells us that this is going to range from 37 to 52%. Okay, but common sense tells us, if we know that of the formed elements, 44% of the 45% of the formed elements is red blood cells. So common sense tells us that a normal hematocrit count is going to be what? 44. Approximately 44 or 45%. Okay? But the range, correct range, is 37 to 52. Just so you know, 37 to 52. There was a side note that I wanted you to know about that. Okay? The hematocrit test is usually 3 times the amount of the hemoglobin test. So, if we did a hemoglobin test first and we got, I don't know, let's say 12. 3 times 12 would be their hematocrit. Okay? You need to know that the hematocrit count is usually 3 times. How many times?
3
How many
times.
times?
3 times.
Very good. 3 times the hemoglobin test. Okay. What kind of tube are you going to collect a CBC in?
Lavender.
Lavender top tube. Who knows the order of the drop?
Yellow,
Light blue,
red,
Gold.
green, lavender, gray. Young little rude girls get low grades. Yellow, light blue, red, gold, green, lavender, gray. Okay, very good. Hopefully you remember it. Okay, because I'm going to be expecting it. Hey, if we do our little wine test of the urine, so to speak, that smell test, and we smell something really fruity, what?
Diabetes.
What kind of diabetes?
Type 2 more like
Mellitus, okay?
Mellitus.
But this tells us what is happening. This tells us what about their diabetes. Okay.
It's bad. It's
Okay.
real bad.
It's really bad. It's uncontrolled. That's going to be that key word there. It is uncontrolled. If you do that little whiff test of that urine and it's a really strong fruity or sweet odor, then that means they have uncontrolled diabetes going on. It is out of control. Okay? To think about it in this way, it means that it's filled with glucose. And like I said, your glucose is your $20 bill of your body. If your body is throwing away the glucose, then we know, whoa, there is something going on. That's like you just throwing all the money out of the bank. We don't need this. You need that. You want the money out of the bank. Okay? So, think about it in that manner. What about CLI? First off, what does CLI stand for?
Clinical Laboratory Improvement Amendments in 1988.
Very good. Clinical Laboratory Improvement Amendment of 1988. But particularly for CLIA waived tests, why are medical assistants allowed to do CLIA waived tests?
Because they don't need no training.
Simple.
no extra training.
No extra training. Not that hard.
Simple test.
Simple.
Once
Once somebody's really good at reading, minimal risk for failure. Okay? It is unlikely you will fail at doing this test. Okay? Minimal risk for failure. The serology department, what does the serology department do?
They study
The immune
blood.
system.
Immune response, particularly,
antigen, antibody.
yes, antibody antigen
Antibody antigen.
response. Which in a sense is immune
I'm
response.
gonna pass this test.
So wait a minute, is serology immunology? Are those the same?
No.
No, right? Because serology is looking particularly at antibody antigen response, while immunology is looking at the immune system as a whole. Okay? So we might say that immunology trumps serology, but they are two different departments, so to speak. That first morning specimen that we do of urine is going to be the most what? You said it?
Common.
Concentrated. Very good. It's going to be the most common. Yeah, you didn't get the last part. Intrated. Yes, that one. The first morning specimen is the most concentrated. And is this the most preferred one too? Yes, absolutely. If we really wanted to see what's going on with your urine, like what's really going on, like what's really going on, then we would do a first morning specimen. This is the most concentrated one. Okay? Most concentrated one. Okay. So did you say that about the next one, bilirubin? Let's talk about some bilirubin. Okay? I told you a lot of stuff. The chain of understanding for bilirubin was kind of a long one. I told you that bilirubin is created as a result of red blood cell destruction. Okay? But if you have bilirubin in your urine, it tells us that it is an indication, so to speak, that there is something wrong with your liver. Okay? If you have bilirubin in your urine, there is a liver disorder. Something is going on. Okay? Something is going on. If there's bilirubin in the urine, then something's wrong with the liver. something that, is this too high for you? Can you see? Okay, sweet. So when we talk about the multi-sticks reagent strips, Jonesboro bus is here, but I recommend you stay. Not to miss it, okay? Because they ain't gonna leave without you. All right, but because class ends at 10. Okay, so here's the thing. Let's finish up. Here we go. When using multi-sticks reagent strips, how many times do you dip it? Twice. Very good. Remember that. First off, somebody tell me what quality control is.
It makes sure that the laboratory tests are accurate.
Right. Make sure that the laboratory tests are accurate. Okay? So when we're doing quality control of the multi-sticks reagent strips, that's actually what it's called, multi-sticks reagent strips. Okay? When we're doing that, we particularly are doing this as a test to make sure it's okay. Okay? So we may say for quality control measures for the multi-sticks reagent strips that we would check, or would you say that you should check the expiration date on the bottle?
Yes.
Yes.
Yeah, that's a pretty good idea. Would you want to make sure you keep the lid on the bottle?
Yes.
Yes, that's a good idea. Would you keep the strips in the original bottle? Some of y'all have a problem with this.
I mean,
Yes.
yeah,
Yes.
they ain't gonna line up.
Right, because it's not going to match up, right? All right? But when it comes to quality control, would we record the results in the patient's chart?
No.
No, we would not do that. Some of you are like, wait, what? Okay. When we're just talking about quality control is something that we do often, okay? You should do quality control every day. Everybody should. Like, for example, before you insert that saline into somebody's body, let's make sure it's not expired. Let's make sure that the bag doesn't look like it's torn open. Let's make sure blah, 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 okay? So quality control doesn't necessarily have to do with the patient's individual results. Not all the time, at least. Okay, so that's why that one is the wrong one. Okay? A lot of you probably would have gotten that incorrect. So make sure you understand that. Here we go. When we talk about specific gravity, some of you had high specific gravity when we did a test, when we did the test on your urine.
Right.
And I said, well, it's because it's what?
Concentrate.
Have you not urinated? But what does that tell us? Yes, you got to finish that. Learn to finish that word. Concentrated. Yes. If specific gravity tells us about the kidney's ability to concentrate the urine. This is to say that the kidney it should be slightly heavy. It should be concentrated, but it shouldn't be too concentrated, and it shouldn't be too light. Goldilocks effect. We want it just right. Okay. Those 3 confirmatory tests. Anyone remember what they were called? Is Clinitest one of them? Clinitest is one of them. ACE test is one of them.
And
ICTA test is one of them. Coal sticks is not a confirmatory test.
What is not?
Coal sticks. Just know what the 3 are: Clinitest, ACE test, and ICTA test. Okay.
I know it's already written down here.
Mm-hmm.
So let's talk about supernatant. First off, what is the supernatant? What is the supernatant in urine?
The liquid portion.
The liquid portion at the top. Okay. I'm gonna. This one is that in red? No, it's in blue. Okay. So. We're going to talk about this week, particularly how much of the supernatant you pour off in order to look at the sediment under the lab. Under the microscope. Okay, but that's upcoming. You don't have to worry about that. Just know that the supernatant is the top liquid. Okay, it's the liquid at the top. A1C. Okay, kind of relates to GHT. Okay, A1C. What did I say A1C count is? Or what did I say A1C is, period?
A1C is like
A1C. Otherwise,
that's the
called
test that they do for
glycosylated hemoglobin
diabetes, right? A1C? No.
test. Where it said it has to do with red blood cells. Red blood cells live for how long? Or it kind of has to do with GHB, or it actually is GHB.
We just read
All
that
right.
too.
Yeah, we do.
So
Just
here we
read
go.
that.
A1C count is going to tell us
Wait a minute, hold on.
how well you remember I said your blood should live for approximately 30 minutes, excuse me,
120 days.
120 days, okay?
I
Should
wrote
live
that
for
down
long.
too. A1C.
Okay.
Somewhere.
So you need to know that when we are measuring the average glucose every 3 months, not 120 days, this is slightly different. Some of you should have read about it. Okay? That's called a GHT, okay? Or glycosylated hemoglobin test, otherwise called GHB. Glycosylated hemoglobin test. That's what that is. We're testing on the 3rd month to see every 3 months to see what their glucose is. Okay? Glycosylated hemoglobin test.
But wouldn't that be looking for diabetes? Is that that's
So
not
to speak,
have
it's
anything to
to
do
make
with diabetes?
sure that your diabetes is under control.
Thank you.
It has
You're
to
looking for
do
the glucose level.
That was a key of
That's what
remembering.
A1C
Is that A1C is going to be that every
Right.
120 days to see. Diabetics have to get that too, okay? But for the A1C,
Okay, what up?
or excuse me, for the GHB, it's going to be glycosylated hemoglobin test, and we're just checking their sugar every 3 months to see what is their blood sugar. Okay, and this is a detailed test, very detailed test. Okay, what does ESR measure?
How fast the
It was just
red blood cells settle.
That's right. That's exactly what I want you to remember. How fast the red blood cells settle.
Right.
How fast the red blood cells
Settle to the bottom of the tube. That's what ESR is. Erythrocyte sedimentation rate. I know y'all are ready to go home, but we have another slide to go through. So, not done yet. All right, so when we talk about okay, so let's talk about some of the errors that we can make when. What's probably the number one error that you guys made when y'all first did? Say again?
not using the right bottle.
Right, not using the right bottle. Basically, mismatching the reagent strip versus the bottle. Okay, that's the number one error that can be made when using those reagent strips. Okay. Finally, for this one, where it says, how do I want to go with this? How can I break that down?
Viewable reaction.
Yes, it says viewable reactions equals viscosity. Okay, so basically, here's the thing. It says viewable reactions equals viscosity. Okay, when we can see the reaction occur, that is what defines viscosity. That's what that means. When the reaction is viewable, we can look at it and we viewed a reaction
it's like
occurring.
visual.
That is a measure of
Viscosity.
viscosity.
When you can see.
Yeah, it's
The
It's a
reaction.
viewable reaction. Okay, we can look at it and it changes. Kind of like when you dipped it and it changed colors after 2 minutes, and then it kept changing colors for some of y'all. Okay, that's a measure of viscosity.
Viscosity.
viewable reaction.
I understand what I got there, but that's not what it's saying right here.
Equals viscosity. Yes. And we keep on moving. Yes, I know. Hold on.
Because it's going to say on the test, stickiness or thickness as of blood state of being vicious.
This particular test is actually more, it's like 57.
It's a 7 question.
Wow. I thought I was gonna ask the test.
Which is 7 more than their usual is. That's what it is. Because like I said, it's a really detailed chapter.
Yeah.
Anyway, let's finish this up. I'm sure you guys want to go home. Okay. Let's talk about the centrifuge. Okay. Remember when I turned it on, and what did it do?
It started shaking.
Shaking and going crazy, right?
Yeah,
Why?
balance.
What was this is a specific word. It ends with balance. Counterbalance. It is not counterbalance. Okay? This is to say when it's counterbalanced, that means that if we got a tube over here, we need to have a tube over there. If we got a tube over here, we need to have a tube over there. Okay? I'm going to make sure to tell the security guard that you guys need a few more minutes. Okay?
He loved his job.
I'm trying to tell you now, but he is thorough.
Is he?
I should took pictures of him. You know what I'm saying?
Just wanted to make sure that y'all weren't left kind of like off. Okay, so anyway, right. Well, tell you what, if it's up to you. You can leave if you would like to. This is a review time just for you. So here we go.
I know that's right.
When talking, let's talk a little bit more about the centrifuge because we're gonna have a couple of questions about that, and we've gone through it already. But when talking about the centrifuge, okay, we need to know that particularly it spins down to do what? To
Separate solid from liquid.
right? To separate the solid from the liquid, so to speak. Separate the solids from the liquids, particularly separate cellular and liquid portions of the blood. Okay? When we're talking about blood, it's separating the cells and the liquid. Because the cells are really the solids. Does that sort of kind of make sense?
Yeah.
Okay. So, I already told you about counterbalancing. Let's talk about venipuncture really quick. Okay? When you place the tourniquet for venipuncture, okay, and this shouldn't be new for any of you guys, but when you place the tourniquet for venipuncture, you need to ensure that it is at least 3 to 4 inches above the site. Okay, so if we were, let's say the antecubital space, which is our preferred space for venipuncture. I know I told you guys that, right?
Yes.
Okay, this is to say, always say, oh, put 3 to 4 fingers, right?
Mm-hmm.
Maybe you were taught that, hopefully.
Yeah.
All right, this is what they're really wanting you to do is go at least 3 to 4 inches, preferably 3, but 3 to 4 inches above the site, okay, that you are trying to stick, okay? What goes to the top when you centrifuge blood?
The plasma.
Plasma. Okay, very good. About the veins, what vein is proximal to the radius?
The meat.
Salad.
What vein is medial? Hmm?
I wrote that down too.
I just gave you the first word.
The median.
Median cubital, otherwise called the median cephalic or median. What's the vein that's proximal to the ulna? Basilic. Okay, so remember I told you that what happens is that it separates off into 2 veins. Starts maybe it joined up right here, then it breaks off. And so when it breaks off into those 2 sides, it's technically called the median cephalic and the median basilic because that's what it's closest to. Hopefully that kind of makes sense. But particularly when we talk about what particular vein we want you to use, we want you to go for this specific one. It's going to be, once again, I already told you this, the median cubital. And then our secondary is going to be cephalic. Okay? And the reason why we really don't want you to use the basilic unless you have to. And the reason why is because the basilic is known for rolling. It will roll on you real hard. Like it will roll totally like somewhere else. It'll be crazy. Okay, so, but the cephalic and the median cubital veins are very anchored down, so they really won't do a lot of rolling. That's the reason why those two are the preferred veins when we go into, when we're talking about venipuncture. Okay, so we already talked about quality control, but what about quality assurance, so to speak?
You make sure the
Procedures.
quality and assurance. Quality.
Policies and procedures, okay. Policies and procedures. Particularly what I want you to know about that, okay, is when we're talking about quality assurance, we're talking about how, when we're looking at those results of the quality control and saying, okay, we're evaluating it to say, all right, this is okay, this is not okay. All right. So like I said, you guys are right in saying that, yes, these are the standards, these are the rules and regulations, but when we're really doing QA quality assurance, when it comes down to actually testing, we're looking at those results and saying this is this result is acceptable, this result is not acceptable per the rules and regulations. Does that sort of kind of make sense? Okay. So that's that. I told you which magnification level needs oil immersion.
100.
100 times. Know it. Okay. The Microsoft Lens, just so you know, this might be a new thing for you. Okay. That Microsoft Lens needs to be cleaned with a special lens paper. Okay. Not just some random paper towel or your shirt or nothing like that. Okay. It needs to be a special. Yes, Kim White. It needs to be a special paper that you use to wipe it down. Because remember, we're magnifying things, and that kind of makes sense. If I wipe, my jacket off, use my jacket to clean it off, and then one little dot is left. When we magnify times 100, that little dot looks like, oh my God, it's Godzilla or something like that. So that's why we want to use something that leaves no residue, that leaves nothing behind. Okay? Sometimes you wipe something down and it leaves those little white stuff behind, blah, blah. We don't want that. Okay? All right, so okay. I told you this sometime, I think yesterday. Okay, we touched on chemistry today. We talked about it the other day. Chemistry is going to be testing those fluids, like we're going to be testing the plasma or serum. We're going to be testing CSF, so spinal fluid, blah, blah. Chemistry test is not for blood. We don't test blood for chemistry. We test the plasma or serum for chemistry. That sort of makes sense? Like two. Okay, so let's see. You will see several questions about this. When we're studying the immune responses, which are antibody-antigen reactions, what is that called? Serology. You need to know it. Okay. When it goes into this one I didn't like. Okay, and you're gonna notice it when you see it. Okay, but technically, when you're asking patients questions, and I really think this is a typo, but this is what the book says. I'm probably actually just going to give everybody a pass on it. So temporarily remember this, so to speak, okay? When you're asking patients questions, we don't want you to ask open-ended questions, which is not necessarily true, okay? I know, okay, but that's technically the right answer. If you get it wrong, I'm probably just going to give it to you because that doesn't follow up with actual things that you're going to do in the field. Okay, so that's why this keep that one kind of on the down low. Okay, so when should you report results to a patient?
Never.
Okay. what is the only exception to that? The only exception.
There is a one.
If the doctor
After
gives
the
you
doctor.
Exactly. If the physician says, hey, go do that, or hey, it's okay for you to do that, then that's okay. Okay? But if the physician don't say, hey, that's cool, it's cool, you can do this, it's not okay. Okay? And the physician will almost never say that. I've never been a day where the physician's like, yeah, you can go tell them about the results.
Tell him you got
No, he
AIDS.
doesn't do that. Okay?
You HIV positive, dude.
Just like that.
Almost there,
They
guys.
say 3 levels.
Hmm?
They say 3 levels. Rapid script test.
Oh, yes. 3 levels, yes. What are the 3 levels of CLI 88?
High, moderate,
High,
and
moderate.
wave.
High, moderate, and wade. High, moderate, and
wade.
wade. Okay?
High, moderate.
Just so you know, a rapid strep test, which is where you put a swab at the back of their throat, okay, is considered a waved test. Because 1, there's no risk for failure, and 2, it's very simple. It can be done. A very minimal amount of training to teach someone to put a little swab in the back of somebody's throat, okay, which we're actually going to do here this week, okay, and to put it in a tube to test for strep, okay.
Doesn't mean I do it up in your
Oh,
nose.
I'll focus through tomorrow.
I had a lot to do with my
I
phone.
forgot about that.
No, that's a different test. Different test. You won't really
I'm
see
supposed to say
strep.
what answers.
That's not strep. That's gonna be
That's like
maybe
MRSA, they do that too.
flu.
Oh,
Yeah,
I was a
flu.
multiple choice.
MRSA is really gonna be more biopsy type thing.
No, it was something that they gave him, it was, when he, what was it?
Well, that's-
Wow.
okay, so really quick, this is rather kind of a gimme. You should already know this. But your analysis, is your analysis used to detect dwarfism?
No.
No. Okay. Is your analysis used to detect diabetes? Maybe sometimes.
Yes.
Yeah.
Yes.
Is your analysis used to detect kidney disease sometimes?
Yes.
Yes.
Okay. Is your analysis used to detect if you got a UTI?
Yes.
Yes. Okay. So, but once again, is it used to detect dwarfism?
No.
Okay.
You see
Get
that?
that wrong. I'm just. I just didn't know. I don't know what to do.
Come on, she's short.
All right. So, with pediatric urine specimen, okay, it needs to be sterile. Just so you know,
It needs to be what?
pediatric urine specimens it needs to be sterile. Okay, it needs to be a sterile container. You don't just use any old container that we just got out of there. No, don't use that. Okay, it needs to be a sterile container. Okay. Basically means a never opened before container. Never opened before until you put their urine in it for pediatric, particularly babies. Okay? Now you've seen in pediatrics where they say, hey, go void in this cup. Okay? But then that's why I say, really, this is for babies. Alright? But particularly, you just want to make sure you only use a sterile container for that. Some of you should have read about. Almost there, guys. How do you collect a midstream clean catch urine specimen?
First you wipe from
Right.
front to back,
Front to back.
Aseptic wipe.
then you pee a little,
Urinate.
you urinate a little, then you stop midstream. And
Well,
then
you know
catch
it. Well, you know it right now.
Okay, sounds like you guys got it. Right? Okay, so basically wipe for females front to back. Okay,
What about for men?
for men,
one wipe.
okay.
Does it matter which way you go?
It don't matter.
One wipe across
North,
the
south, east, west, northwest, south, it don't matter.
Okay.
All right,
One
so
wipe across the eye.
front to back.
It winks
Okay.
at you.
But of course, you're gonna make sure with men do the tip, not the sides or anything.
Just one wipe
The tip.
down.
Wipe down, okay? Not, don't scrub it, just wipe, okay? Anyway, females front to back, okay?
You real
Not with
trash.
not with a alcohol pad. There's a specific one you use.
Antiseptic.
Okay, then you're going to void or urinate a little bit
In the
into the toilet. If this employee helps screening, do not flush. Okay, and then you're going to stop. Before you've let out all your urine, you're going to stop, Then you're going to urinate, void, micturate into the cup.
And don't fill it
Don't
up.
fill it to the brim. Hey, we don't need that. That's okay. Just fill it up to this line. There'll be a line on it.
Mr. Brown, you keep saying don't flush. Why don't they want us to flush?
And that's employee health screenings. Okay?
Oh,
Because they will
employee health
sometimes put
screening.
water
Oh, okay.
or stuff like that. You put like 3
Okay.
drops of bleach in it, it'll sterilize it. That just different things will cause it to just be haywire and invalidate the results. Blah, blah. Okay? So anyway, and then bring the cup to us. And then that's it. Basically, why would we do a midstream clean catch urine specimen?
Oh, God, got it
Where
already.
is it? Dang, where is it?
Why would we do that?
Oh,
For
what's up
like
there?
babies and stuff like that.
For
No.
court. For court.
No. Why? Why would the doctor say, "Hey, I want a midstream clean catch urine specimen"?
Because it's more sterile.
Right. It's cleaner.
Oh.
Okay. It's not sterile, but it definitely eliminates a lot of the trash that may or may not be down there. Okay. So this is the saying that look, your original results, those were really weird. They were kind of off. Let's do a midstream clean catch urine specimen just to see if maybe there was something down there.
Some
blah,
trash
blah.
coming out of the urine, right.
We don't want the
We're
trash in the
trying to
urine.
pee
Okay?
the bad
We
stuff
wanna
out and
eliminate
get to the center
You
of the
gotta say
thing.
urinate, not pee.
But we don't want to do a catheter because that would be the next step. Catheter, really unpleasant for men, sort of unpleasant for females. Okay, coming. Just 1 second. Okay. Okay. So let's finish up here. Okay. First collection
In the
of a
morning.
24-hour specimen. Throw it away. You've not heard that before, but you read it or should have.
Throw
read
it away.
Okay. Discard the first voided specimen. Okay, in a 24-hour
Oh.
collection.
Oh, okay.
24-hour collection. We're collecting for 24 whole hours. Okay, flush the first one. We don't want that one. We want the rest. Not gonna go into why. We can ask me tomorrow. Anyway, chain of custody is going to be particularly legal matters. Okay, so this is particularly for court or something like that. So you just want to make sure you do the right thing when it comes to court. What's one thing? Which tube? Okay, this we should have been reading, but I'll
Red.
tell you here. Actually, that's right. Which tube has no additive? And it's the
Oh,
red
red,
tube.
the
The
small.
red tube.
But this
Okay.
one with the thick, the red little leg one. Oh, no, it's yellow. It's considered yellow though.
No.
No
Well,
additive.
yellow also doesn't. That one's sterile. But red particularly is the answer to this. No additives. Okay. You already know order to draw. When do you release the tourniquet when you're doing blood draw?
Before
Last
you
minute
take
timer.
the needle out.
Right.
Last.
Or as
No,
the last
as
tube is
the
filling.
filling.
As the last tube's filling, take the tourniquet off. Okay. Almost last thing. When you're doing blood screening, like blood crossing screening, we need to figure out what type of blood you have, A positive, B positive, whatever. Is that a CLIA test?
No.
No, it is not. It is not. It is not. Okay? Blood to figure out what kind of blood you have is not a CLIA test. Okay? And then when we're talking about fasting, you need to make sure that you tell the patient not to do what?
Eat.
For
Don't
12
eat.
hours.
Eat or drink except for water.
For 12
Okay, for 12 hours or for whatever time the doctor said. That's that. This will be on YouTube at some point in time.